Hi, I'm Dr. Cavanagh with Chisholm Pediatrics, and I'd like to take a moment to address ADD in the time of the COVID quarantine. Right now, schools' curriculums can vary anywhere from full online classrooms to hodgepodge assignments assigned to the kids. But one thing that's the same for all patients with ADD is that they're easily distractible. And now that falls on us as parents to help direct and keep them on track. The quarantine provides us both challenges and opportunities in that respect. As far as challenges go, we see the challenges of the who, the when, and the where. The challenge of the who is self-care. During times of stress, it's very easy to let self-care kind of lax a little bit, but it can be even more important. So make sure that we're getting good exercise, whether that's just a workout of the day inside on a rainy day or taking the dog out on a walk when we can. To sleep. During this time, sleep can become more critical, and in fact, often during times of stress, adults and children alike both need more sleep. So if you notice that your child needs more sleep, that could be a natural thing during this stressful time. And third, hygiene, making sure that we change our clothes at least once every few days, even if it's just to a fresh pair of sweatpants. When? Schedule can become very important. During this time, routine is thrown out the window very often, but kids thrive on routine. The younger the child, the more important it is to have some type of structure. And not only structure, but structure that's communicated up front. That includes like a good, general time of waking and going to bed, general time for studying, having chores that we do, having a routine of chores, and then also having a family meal together. Studies have shown that families that continually eat dinner together generally have healthier relationships. And it's especially important during this time that it gives the kids a venue to discuss what's going on in their hearts. And then last, where. So we've got the who, the when, and the where. The where really is important for studying, having a specific study environment, one that is distraction-free for patients who have ADD. So oftentimes that may not mean having all the siblings study at the table together. At the same time, sometimes patients with ADD don't do as well just by themselves, because then they can let their minds wander. So they may need somebody to co-regulate with them, whether it's having a parent in the room also working at the same time, or having another sibling that's also working, or even having a pet in the room like a dog or cat. So those can be very important, helpful things. It really varies from student to student. In addition, in the work environment, it may be important and helpful to have a bouncy ball for them to bounce on, or some type of thing for them to fidget with. So we've talked about the challenges of the who with self-care, the when of routine, and the where of having a good study environment. The opportunities. So there are opportunities here that we don't have in normal day-to-day structure that the quarantine provides. We have more flexibility. Oftentimes kids in a school environment where they have to sit and concentrate for 8 hours, it can be very challenging. But in this time period, we have the opportunity of more flexibility of breaks. So that's something to think through. Also, when is the best time for your child to study? Some kids study better early in the morning, some in the evening. It's important to be a student of your kid to know when are they most effective at studying, and having a set time that they know that that's when they're going to study. At the same time, lots of grace in between, lots of breaks. I recommend during those breaks, if they are online, to have unplugged breaks. One area of flexibility that I've seen personally is if your child is on medicine, oftentimes we're on extended release medicine, this might be an opportunity to, might be more flexible to be on a short-term, short release medicine. So for instance, if I have a patient that's on 10 milligrams of an extended release that lasts for 8 hours, I can prescribe you a 5 milligram short release that you can take either once or twice a day, whether you need 4 hours or 8 hours. So that could be an option. So if that's something that you'd like to do, certainly contact our office. If you're unsure of where to go with this during this time, whether we want to try off the medicine or we want to do a trial of the short-acting medicine or continue what we're doing, but we're unsure, certainly we're available for telemedicine visits. Last and most importantly, grace and positivity. please extend yourself grace and your children grace, knowing that during times of stress, no one is operating at 100%, and that's okay. We're going to get through this. Let's get through this with positivity. Our children reflect our own emotions, and so it's important for us to set examples of really focusing on the positive, and as we do that, we will become more positive. If you have any concerns or questions with your child, if you notice any other problems with anxiety or ADD-related issues, we are available by telemedicine visits. Just give us a ring. All right, guys. God bless and stay safe.